As a nurse practitioner, you're here for your patients, but keeping up with all the paperwork can feel like a job of its own. Long hours spent on notes, administrative burdens, and the struggle to find balance. Sound familiar? Meet SOAPNote AI, your intelligent assistant designed to make documentation simple, accessible, and efficient. You can use it on your phone, iPad, or laptop anytime, anywhere. So if you're a nurse practitioner, taking notes has never been easier. I'm really excited to show you the different ways that you can make sure that you take these notes and don't get too stressed out, because I know it can be a lot, but this is going to make it a lot easier. First and foremost, just to note, whatever you end up adding into SOAPNote, it's going to auto-delete after 30 days for compliance. It is a simple and secure platform that's effective for whatever you need. So first of all, I obviously can dictate what I'm saying right now. Say, for example, there's a patient that has some of the following symptoms. A 60-year-old male presents for a routine checkup, reporting occasional headaches, but denying chest pain, shortness of breath, or dizziness. He has a 5-year history of hypertension and admits to inconsistent medication adherence. Blood pressure is 160 over 100, heart rate is 88 beats per minute, and the physical examination reveals no abnormalities. Previous laboratory results show elevated LDL cholesterol levels. Uncontrolled hypertension is likely due to poor medication adherence, increasing the risk for cardiovascular complications. The plan includes reinforcing the importance of medication adherence and providing education on potential complications of uncontrolled hypertension, prescribing combination antihypertensive therapy to improve blood pressure control, recommending dietary modifications, including reduced sodium intake, and encouraging regular physical activity. A follow-up appointment is scheduled for 4 weeks from now to monitor blood pressure and assess adherence. So now what it's doing is it's taking that dictation and transcribing it. It's really nice. So you can either have that conversation with the patient and have it record, or if you want to just verbally talk about what happened, this is going to do the same thing. It's going to make a SOAP note based on the information. I'm going to give you a breakdown a little bit more detailed of those two different types of recordings in a moment. As you can see here, it created a subjective, objective, assessment, and plan in that SOAP note, even giving the ICD-10 codes, which I think is really useful. I can put a patient name here on the bottom, so I could just put Jane Doe and say that the visit was today or whatever day it was. And now inside of my notes, you'll see right here that it pops up and I can access all of my notes very easily right here. Now getting into those differences between the audio SOAP notes. Now we can take a look at this section in the audio SOAP note spot right here. So what would be the reason that someone would use dictation or recording sessions? There's two different reasons for this. So one, if you just want to dictate your notes, so this would be something where, after a session is finished, you just want to talk to yourself and to the application more specifically and have everything you're saying get dictated. That would essentially be what the new dictation option here is for. So this is essentially you getting that brain dump of notes out of your head after the session is complete. This is very important because some of us actually retain things pretty well and can verbally say it out loud. So it's a lot better for some of us to do that than typing it out or writing it out manually. Session recording, though, is when you turn on the app, and essentially what you're going to do is record the session that you're having as a nurse practitioner with the patient. So this is essentially going to have the conversation between yourself as the nurse practitioner and the patient be recorded, and then the notes will generate directly after that conversation is completed and you stop the recording. And we have a new feature if you are using telehealth to record your telehealth capabilities as well. The recording will automatically be deleted from the system, and after generating the note within 24 to 48 hours. On top of that, the data is never going to be used to train AI. I think that's a really important thing to know. We really care about the privacy and security parts here. So let's show another example. If you are somebody who is in this space. So say, for example, you had a visit of 10 days ago. You can also select the two languages, English and Spanish. Say you're somebody who writes shorthand notes. You do still want to write those notes. You're not simply going to be doing audio recording. You want to have the text here. Totally fine. All right, so for the example I'm going to use, let's say it's somebody like Jake Martin, and I'm going to add this note, this shorthand note I wrote, to maybe someone who has a upper respiratory infection. As you can see, they have cough, nasal congestion for the last couple days, mild fever, sore throat. Nobody likes these things. And you can see the subjective are coming out here. The patient is a 30-year-old male who presents with a cough and nasal congestion, 100-degree temp. Professionally, the patient is in the work IT sector. Okay, social, family history. All right, let's make the next step in here. We can also go to the objective. All right, so the objective is done, and you'll see it's got the 100-degree temp, the blood pressure, pulse, beats per minute. Awesome. So this is the objective stuff. And then we can generate the assessment based off of this information. So just gonna go through one by one in these steps. Pretty simple stuff. The assessment's done. Cool. Pumping this out. So problem list, acute upper respiratory infection, likely. Yeah, mild fever. Diagnosis is based symptoms. It's an upper respiratory infection, probably. Okay, fair enough. And then when this is done, we can actually generate the plan, and that will be it. We made a SOAP note with just our shorthand notes and some AI to expand on this. And inside of here, you'll see as well, we have the ICD codes, which is very nice. Saves you some time there. And all you need to do now is basically copy these into whatever system you need. The EMR system is going to be really, really much more well kept up. You're not going to fall behind on anything because you're going to just copy and paste these anytime in the next 30 days, because that's how long it takes before it auto deletes. And all of those different questions that you may have in your head of, oh goodness, how am I going to get all of these into the EMR at any point soon? They're going to get done. You're just going to copy and paste it because you took some shorthand notes or recorded the verbal exchanges that you had with your patient at home, finishing notes with ease. It's so simple because of the cross-platform functionality of this. I would say with this, you can save anywhere from 1 to 2 hours every day, and you spend less time on documentation and more time on what really matters, your patients, and honestly, your own well-being. We're trying to avoid burnout with this. Let's say, for example, you were a nurse practitioner who was starting out their day and they didn't get much sleep last night. It's important to note that you're checking the notes from the previous day on your phone, you're reviewing the details on SOAPNote AI before starting the day, and you're just getting that easy copy and paste into the EHR. And then during patient consultations, you're gonna basically have the experience quickly and easily AI scribing or dictating. And then from there, during your break, probably taking those notes on your iPad, copying and pasting it into your EHR. And then you're gonna end the day with the last few notes that are there and hopefully organizing all of them by the end of the day. So the cycle of being tired can stop. Once you get SOAPNote AI, that extra burden is just gone. And I think the cross-platform functionality really does help here because across everything, when you have it on your phone, then your iPad, your laptop, it's easy to just in any downtime, copy, paste, get it into the EHR, not worry about the compliance, and feel so much better. So for those of you nurse practitioners that are doing great work, we really appreciate you checking out our product. And I want you to make sure that you click the link down below to sign up for a free trial. It's awesome because you actually get to use the product and a pricing structure that I think is pretty fair. You have either $69 per month for unlimited audio notes and dictation, $79 per month for unlimited, so that would be inclusive of the text shorthand. And you also have pay-as-you-go plans. You don't really see that a lot with software, and I think we do a great job there as well. So make sure to click that link down below to try out SOAPNote AI today and reduce your stress. Thank you so much for watching, and we'll see you in the next one.